Good day, ma'am. I am Rachel May M. Morales, Building 2, Section A from Negros Oriental State University, Main Campus 1. So for today's return demonstration, I'm going to perform administering nasal instillations. So for nasal drops, we're going to determine which sinus is affected by referring to medical record. Okay, so let's see here. Okay, so the ethmoid or sphenoid sinus and the frontal or maxillary sinuses are being affected. Next is we're going to assess client's history of hypertension, heart disease, diabetes mellitus, and hyperthyroidism. Okay. So no history of hypertension, no heart disease, no diabetes mellitus, and okay, so no hyperthyroidism. Then after that, we're going to identify the client, check the identification bracelet, and ask client to state name. Maying hapon, sir. Ako si Rachel May M. Morales, sir, ang imong student nurse karon. Pwede na ko i-check imong identification bracelet, sir? Pwede na mo isulti imong ngalan, sir?
RJ M. Morales,
Imong birth date, sir. Kansa man, sir?
August 6, 2011.
Okay, so thank you, sir. Next, using the pen light, we're going to inspect the condition of the nose and sinuses. Then we're going to palpate sinuses for tenderness. So, diri ron, sir, para mag-instill of nasal drops, sir, sa imong ilong. So, pwede ba na ko i-check, sir, ang imong ilong, sir? Pwede na to inawag imong mask, sir? Okay. Okay. Yes. Okay. Tignan ko, sir, kung masakit, sir, ha? Kani, sir?
Sakit,
Kani, sir?
sakit,
Kani, sir?
sakit,
Kani, sir?
sakit.
Okay, so kay sakit man, sir, ato ng tambalan nun, sir, ha? Then, we're going to assess the client's knowledge regarding the use of nasal instillation and technique for installation and the willingness to learn self-administration. So, karon, sir, magbutang ko, sir, og nasal drop sa imong ilong, sir. Tawagan niya, sir, is saline nasal drops. So, willing ba pud ka, sir, nga makat-on, sir, kung saan pagbutang, sir?
Yes,
Okay, sir, so thank you. And then, we're going to explain procedure to client regarding positioning and sensations to expect, such as burning or stinging of mucosa or choking sensation as medication trickles into throat. So, kani atong saline drop, sir. Well, ako ni siya ibutang, sir. Pwede tang makabati og mga effects, sir, para anang mura siyag halang, sir. Pwede po siya kanang gilok, sir, sa imong ilong. So, okay ra ba nimo, sir?
yes,
Okay, sir. So, thank you, sir. And then, we're going to wash hands, arrange supplies and medication at bedside. Okay, so, we're just going to use rubbing alcohol. Okay, then we're going to arrange our supplies. We have here our medication administration record, physician order sheet, facial tissue, dropper, saline nasal drops, disposable gloves, medication ticket, our small pillow. And then we're going to instruct client to clear or blow nose gently. Okay, so we're going to wear first our disposable gloves. So, ayan ni mong mulingkod, sir.
yes,
Sige, pwede ta mulingkod, sir. Pwede ka makasigma, sir, para ma-clear ang imong ilong, sir. Okay. We're going to discard it to our trash bin. So now we're going to administer nasal drops. So we're going to assist client in supine position. Then we're going to position head properly. So pwede ka magigda balik, sir. Okay, straight lang. Then we're going to place a small pillow. Okay, kaya ka, sir?
yes,
So we're going to support client's head with our non-dominant hand. Okay, okay, down. Good. Now we're going to instruct client to breathe through mouth. So, while magbutang ko ani sir, pwede sir nga sa baba lang sa kam ginawa sir? Okay. So for access to posterior pharynx, we're just going to tilt client's head backwards. So, like this. Then, for access to ethmoid or sphenoid sinus, we're going to tilt head back over edge of bed or place small pillow under client's shoulder and tilt head back. So, hanggang sir. Okay. Then down. For access to frontal and maxillary sinus, we're going to tilt head back over edge of bed or pillow with head turned toward side to be treated. So, first is here. The next is this. Then, stroke. Okay. Okay. So, we're going to place dropper at 1 cm or 1/2 inch above nares and instills prescribed number of drops toward midline of ethmoid bone. So we are instructed to instill 2 drops of saline nasal drops. Okay, so sa imo lang ba ginawa sir ha? Pagbutang na ko sir. Okay. 1, 2. Yes. 1, 2. Okay. Then, we're going to have client remain in supine position for 5 minutes. Then, we're going to offer facial tissue to blood runny nose. Then, we're going to caution client against blowing nose for several times. Okay. So, pwede nini mo sir i-trapo sa imong ilong sir, pero ato lang likayan sir nga, di lang ka musikma sir for several times sir. Sige, trapo lang sir. Okay, discard. So after that, we're going to assist now the client to a comfortable position after medication is observed. And also to restore comfort. So, balik na ta sir sa atong comfortable position. Pwede na ko kaon sir. Okay. Okay ka sir?
Yes.
And then, we're going to dispose solid supplies in proper container. Then, we're going to wash our hands. Okay. To dispose it in our trash bin. Gusto man imong paminaw, sir, after atong gitambal, sir.
Mura ra gilok.
Okay, sir. So, napabakailan kinanglan, sir?
Wala na.
So, thank you kay sir sa imong cooperation, sir.
Salamat po.
Then, we're going to observe client for onset of side effects 15 to 30 minutes after administration. So, after 30 minutes, sir, or 15 minutes, mabalik lang ko, sir, para check na po ka, sir. And then, we're going to ask if client is able to breathe through nose after the congestion administration. Then, it may be necessary to have client occlude one nostril at a time and breathe deeply. So, ato lang i-check, sir, if okay lang ba ang imong paghinawa sa ilong, sir. So, pwede nimong tabunan, sir, ang imong usa ka ilong, sir, sa imong tulo. Then, ginahawag ilong, sir, if okay ba?
Okay ra.
Oh, pikas na po, sir. Then, ginhawag lalong.
Okay ra.
Okay, so thank you, sir. Then, we're going to re-inspect condition of nasal passages between installation. So, ito lang i-check usab, sir. Okay. Walang hikapon, sir, ha? If sakit pa ba Japon, sir? No. Kani, sir? Sakit, sir?
Wala na.
Kani, sir?
Dili na kayo.
Kani, sir?
Wala na.
Kani, sir?
Dili na kayo.
Okay, sir. Very good, sir. And then we're going to ask client to review risk of overuse of decongestants and methods of administration. So, mangutala lang ko sir kung unsa gitong mga side effects or mga risk go sir kung masubrahan o gamit og nasal drops sir or decongestants.
Burning or stinging.
Okay, so correct. So, kaning burning or stinging of the mucosa, muna siya yung mga side effects sir sa kanang nasal drops or nasal decongestants. So, ang iyang mga posibleng risk sir, if masobraan na to gamit, pwede siyang mag-lead into mas dako ng problema. Imbes nga, mga simple lang ato mga gipambati ron, pwede siyang madako if masobraan na to gamit. So, pwede siyang mag-lead into chronic sinusitis. So, pasabot sir, kaning imong mga sinus, kato ako mga gipang hikap kanina, pwede to siyang mang-dagko or mang-swell. So, dapat sir nga, if magpatulotan na ay prescribe sa doktor o atong i-follow ang kung unsa ang sakto nga dosage po or kung pila ka drops. Then, mangutala lang ko sir kung diin sa dito nato sir pagbutang ang nasal drops sir.
Deposition ang ulo din. Di patulo.
Okay sir. So now we're going to have client demonstrate self-administration. So nata diri nasal drops sir. So pwede nimo i-demonstrate sir kung diin sa dito nato sir pagpatulo ni ganina. So di lang nato abrihan sir. So for demonstration purposes. Okay, so
1, 2, 1, 2.
okay, so very good. So, thank you kay sir sa imong time sir o sa imong cooperation sir. Napa ba kailangan kinanglan sir?
Wala na.
Okay sir, so if makinanglan ka sir o tabang sir, lang tay call light diri sir. So pwede lang nimo pinduton sir. If emergency sir or if you need something, just press the call light sir. Thank you sir and good day. So for our recording and planning, we're going to record the medication name. Okay, so saline nasal drops, concentration, number of drops. Okay, so 2 drops. Nostril and which medication was instilled. Okay, so both nostril, and time of administration. So 4 p.m. Then we're going to record client's response in nurse's notes. Client experiences stinging of the mucus after nasal drop is administered. And lastly, we're going to report any unusual systemic effects to nurse in charge or physician.